Hey guys, my name's Sam and welcome to PrepMedic. In this week's video, we're talking about eye injuries and how to treat them. One of the first aid questions that I get over and over and over again in the comment section of my videos is, how do you treat eye injuries? Now, obviously the eye is kind of a unique organ on the outside of your body, and it is uniquely difficult to treat because of its structures and what happens to it predominantly in traumatic situations. So in this week's video, we're gonna go through different things you can do to treat an eye injury. We're gonna start with a little bit of anatomy here, nothing too in-depth, and then we're gonna talk about some different types of injuries you might encounter and what you should do if you do see those injury patterns. So first and foremost, your eye is essentially a sphere. Now, it is located in an eye socket, which is basically just a bony, concave structure on your face, and it allows the eye to move in different directions with the use of specialized muscles around it. Now, it is a very soft structure, and the main portion of the eye is actually hollow, and that is filled with what's called vitreous humor. Now, that is a jelly-like substance that gives the eye its shape and its tautness so that you can actually see light through it and it gets to the optic nerve. Now, in the front of that, you have some aqueous humor, which is the same similar jelly-like material, but there's a lot less of it, and that's kind of where your iris and your pupil are located. Now, obviously we use the eye to see, but because it is such a thin film of tissue around it, now it's pretty strong for what it is, but because it's so thin and it's filled with jelly, if you get a penetrating object to the eye or blunt force trauma to the eye, there can be some serious issues. And the consequence for such is going to be blindness or potentially death, because this is a pretty direct route into your brain behind that eye socket. So with this, we have to treat it very specially so we're not doing any more harm to these patients. Remember, one of the first tenets of any kind of medicine is first to do no harm. So we do not want to be making whatever injured them any worse, and that's kind of what our treatment focuses around, because in the pre-hospital environment, we're really not going to be making this better for the patients. So the first thing I want to talk about is somebody getting something in their eye. Now keep in mind, this is not something that's penetrating the eye, it's not something that's embedded in the eye in any way, shape, or form. This is, you get a bunch of dust in the eye. Now this might seem really, really simple, but the best thing you can do for that patient is just rinse their eyes constantly. You can get little saline bullets like this, and you just put that, lean them to the side and start spraying it in the eye at a low pressure and allow that stuff to run out. You can also go to a sink and do the exact same thing. Now, one thing to keep in mind when you're rinsing an eye, you want to rinse it from the inside out. You can have them tilt their head back, or you want to be rinsing from the corner down. You never want to rinse one eye down to the other eye, because you might rinse whatever's in it into the other eye, and now you have to do the same thing with that eye and you've scratched it all up and it's a mess. So you have to make sure that when you're rinsing it, it doesn't come in contact with the other eye, or whatever contaminants it was comes off. Now, a vast number of materials and hazardous materials and all of that will rinse off just fine with water. Just keep in mind that there are some industrial chemicals that, if they do come in contact with water, can form a exothermic reaction and burn the patient or cause other issues. So if you're dealing with a chemical, I would highly recommend you don't do anything until you know what it is and you have expert consultation. Now, coming down the list of severity of injuries to the eye, we have injuries to the structures around the eye. So probably one of the more common traumatic injuries we see is going to be somebody hit with, a ball playing sports, or, an elbow fist in a fight, something like that, and they cut their eyebrow or their eyelid. Now, these injuries are going to be basically taken care of the exact same way you'd take care of any soft tissue injury. But you have to keep in mind, you can't put too much pressure on the eye itself if it is an eyelid injury. Now, facial injuries, they bleed a lot. They look really, really bad, but very seldom are they going to be life-threatening in terms of external blood loss. So if you have a cut around the eyebrow, you just want to take some gauze, put some pressure on that there, and it will stop relatively quickly. Now, you can take another piece of gauze, or if you're originally using a pressure bandage and you just want to wrap it around the head so it doesn't come off, This is actually a skill I'd recommend you practice, because when you start doing it, especially with people with a lot of hair, you're gonna notice that your wrap, you'll get it all nice and they'll move once and it'll slide right up off the top of their head. So it's a really good thing to practice. Some people like doing what I call an Aunt Jemima wrap. So they come up, they put it on their eye, and then they go around the head and they'll start going around the chin as well. Just keep in mind with that you don't want to wire their jaw shut so they can't talk to you. I mean, that is unless you do want to make it so they can't talk to you. So with those structures, just keep in mind with the eyelid, you don't want to put too much pressure. You know, a light pressure with a bandage over top of it will do just fine. And you want to have a high suspicion that there might be something wrong with the eye itself underneath that injury, because the eyelid is not a lot of tissue and it's not very protective. So if it went any deeper, they might have a scleral injury on their eye. All right, so the next kind of injury we're going to talk about is going to be your blunt trauma to the eye itself. So yes, you might have some bruising around it, you might have some issues with the eyelid, but I'm talking a blunt injury to the eye that can sometimes cause a rupture of the eye, and you have some of that vitreous or aqueous humor coming out. With that, the key is you cannot put pressure on the eyeball at all. The bleeding will probably be relatively minimal. That's not really your priority in this case, because like I said, these are veins, it's very vascular, but they will probably clot off before they reach a dangerous level of blood loss. So in this case, if you have an injury, and you can kind of recognize these injuries where you have a blowout of the eye by a sunken eye, you know, it'll kind of start looking like a raisin, it'll start shrinking in their head a little bit, and I know that's a pretty gross visual, but that's literally what it looks like, because the eye has lost its pressure, it's lost its structure. And as that starts to crumple down, if you put pressure on that, you're going to squeeze that vitreous or aqueous humor out of it, and you're going to cause more damage. That's where an eye shield comes up. So like I said, you don't want to put pressure on it, so we have eye shields. Now, you don't necessarily need to use a commercial one. I personally like using these commercial ones because they fit so easily. And this one's I bought from North American Rescue. I don't actually know what the company that makes this is. But what this allows you to do is it just allows you to cup the eye. It keeps anything from getting into the eye. It limits the stimulus to that eye. And then in theory, it keeps it from moving around quite as much. So what you would do is you'd take this, you just put it over that cups, and then you would take a wrap of some kind and you would wrap it around the face, covering this up completely. Now, a school of thought with eye injuries is that you want to wrap both eyes. If you have one eye injured, you want to wrap both eyes. The thought behind that is that if you have one eye shut, this eye is still able to look around. And unless you're a chameleon, when you start looking with one eye, the other eye is going to track with it at the same time. By doing that, you could be causing more damage to the affected eye. Now, that's been called into question recently, stating that it really doesn't reduce movement all that much, and it just increases anxiety and potentially takes somebody out of the fight or out of the situation. They make it almost impossible for them to self-rescue themselves in a tactical or disaster situation. So there are times where you want to leave both eyes open. Now, my personal practice, if I have the person calm down and I'm able to explain everything and I don't need them to be mobile for any period of time, I will wrap both eyes. But just know that that is something that has a little bit of controversy in the medical community. So once again, for the blunt injuries where you just have, or potentially penetrating injury without an object sticking out of it currently, you just want to keep something over it so it's not pressing down on the eye, wrap it and reduce the stimuli, and try to keep them from looking around or doing anything like that, providing pain control if you have the capabilities of doing so. Now, the next thing we're going to come down to is going to be your penetrating injuries. So in EMT school, they always gave us the scenario, a skier going down a run and they run into a tree branch and now they have a tree branch sticking out of their eye. Well, one of the number one things you never want to do unless it's impeding the airway or impeding CPR is remove an impaled object. You do not want to pull an impaled object out of somebody because the act of doing that will potentially cause more bleeding and it will damage more structures. This is a surgical emergency and all we need to do is stabilize that object in place. So there are a couple different ways we can do that. Now, if it's a stick or if it's something that's attached to a bigger object, we just want to cut that, and we want to cut it enough so that the weight isn't pulling down on the face, but we don't want to cut it so close that we lose visual or we risk damaging a object around their eye. And we can do that a number of ways. You have to figure out whatever kind of object it is. On a tree branch, we'd probably just snip it off if it's small enough. You might have to use an articulating saw or something from the fire department so you're not doing this motion with a handheld saw and making it worse. So the first thing you can do is you can start just holding stabilization, making sure it doesn't move around. And there are two objects that I like using in these situations. Number one, we call it a donut. So this is just a piece of roller gauze that I took and I wrapped it around my fingers, and then I started wrapping around itself, and it creates this gauze kind of bandage. And what this is meant to do is basically it's the eye cup without a center on it. So we take the impaled object, we put that straight through the middle, this will rest on the eye, and then I wrap around the object that's sticking out to just hold it in place. It's not putting any pressure down on the object, so it's not impaling it further into the eye, but it is also not letting it move around, and we're keeping some of the contaminants out of that injury site to hopefully reduce the risk of infection down the road. The other thing you can do, now I wouldn't usually use a solo cup or a plastic cup. This is just all I had laying around my house. You can get a styrofoam cup, pop the bottom out of it, and it basically becomes one of these. So you can put the impaled object on the outside, it'll be sticking through here, and I'd like to use a little bit of a smaller object for this. And then you're gonna wrap around the same way you did with the donut. Both are pretty easy improvised ways to secure an object from moving around too much on the eye. So these are really what I think a lot of EMTs, first responders, wilderness first responders especially, are taught for how to deal with the eye injury in these cases. And with the impaled object, the school of thought is still you're going to wrap the other one too. Just like I said, know that that is somewhat controversial in different situations. All in all, the basic principles of managing an eye injury are do no harm, so don't make it any worse than it already is. You want to rinse out any gross contaminants if there's no actual trauma and it's just some dust in the eye or something like that. If it's impaled, we do not want to rinse anything out because it will actually get into the eye, will cause all kinds of issues. And with that, we just want to wrap it. If there's no impaled object, keep pressure off the eye, wrap that around. You can wrap both. If it is an impaled object, we do not want to remove that impaled object because we'll do more damage. We want to stabilize that in place and get them to the OR as soon as possible. And we can do that with a donut, we can do that with a cup of some kind, or we can do that with a commercial device, which I personally don't think are really necessary, as you can make these just fine and keep them in your kit. This was a pretty rapid fire video, so if you have any questions, please leave them in the comments down below. Like I said, this does not constitute real training. This is not hands-on. This is for your information only. With that being said, I will see you next week.